Hi, this is Jason Kilmer from the University of Washington, representing Washington's Young Adult Health Survey, and in this video, talking about what we know about driving after cannabis use among 18 to 25-year-olds. The Young Adult Health Survey is funded by the Division of Behavioral Health and Recovery within Washington's Healthcare Authority, and it's an annual survey that started in 2014. We have 10 years of data now among 18 to 25-year-olds in Washington. We recruit using a combination of a direct mail invitation to a random sample from Washington's Department of Licensing, as well as advertisements on social media platforms. And it's a completely confidential survey that's been in place for 10 years. It lets us look at what changes have we seen over time, if any. One of the things we've been focusing on is driving within 3 hours of use. Why 3 hours? Well, it takes a little bit of history. The authors of Initiative 502, which was Washington's legalization initiative, set a per se limit for driving under the influence. What does that mean? It means if you're above the threshold they defined, that's a DUI. Per se means if you're above that threshold, no questions asked, it's a driving under the influence. They set it at 5 nanograms of THC per milliliter of blood for those over 21 and any positive amount for those under 21. Why'd they pick 5 nanograms? It's not the same as being at the legal limit for alcohol of 0.08. I mean, they're very different substances, but you see similarities in impairment with reaction time and with challenges shifting focus when there's multiple competing stimuli, other cars, pedestrians, lights, animals, as you see with 0.08 for alcohol. So the million-dollar question is, how long does it take to drop below 5 nanograms? At the time the Initiative 502 was written, there was one study by Groten, Herman, and colleagues saying 3 hours. So in our young adult health survey, we asked that same time frame. If people had used within the past 30 days, they got a question, have you driven within 3 hours of use? No would mean they likely didn't drive under the influence. Anything that was one time or more means, unfortunately, they likely did drive under the influence. As a quick side note, an article by Fisher and colleagues came out in 2022, providing guidelines for lower risk cannabis use and recommended waiting at least 6 to 8 hours after vaping, smoking, inhaling before driving, 8 to 12 hours after use of edibles, oral ingestion. So what did we find? If you look at the left, it's cohort 1 from 2014, and moving left to right, it's all the brand new cohorts. In 2014, on the one hand, 50.59% said, I've never driven within 3 hours of use. On the other hand, 49.41%, almost half, said they had driven within 3 hours of use. Now, there are declines in driving after cannabis use between cohorts 3 through 10 and cohort 1. That's why those are all circled. Those are significant, statistically significant differences. There's also a significant linear trend toward less endorsement of driving within 3 hours of use. By the time we get to cohort 10, 68.69% say they've never done this. Unfortunately, that means that 31.31% have driven within 3 hours of use. With alcohol, we certainly hear people say, I know not to drink and drive. People know if someone's had too much to drink, get their keys, call them a ride share, something like that. There's the potential we have more work to do when it comes to cannabis use. And we certainly hear in our work with young adults, people say things like, well, I drive better when I'm high. The data certainly don't back that up. And so if someone has made the choice to use, as they look out for themselves and as bystanders look out for their friends, people they care about, be aware of those recommendations to wait 6 to 8 hours after vaping, smoking, inhaling, 8 to 12 hours after use of edibles.